finally we got Mr. Shadi, who has supported a lot in arranging all these things. So I think from this event you can get all your tests done, whatever you have, any concerns related to your health, you can speak to Mr.
Dr. Mohammed.
Dr. Mohammed. Okay, thank you.
Good morning, everyone. Faculty of Medicine, right? Today, inshallah, we will talk about some medical emergencies, some general population, how to deal and how to face such cases. First of all, we will talk about seizures, we will talk about hypotension, we will talk about seizure is fits, that commonly means convulsions, usually say, tenders. Hypotension is decreased level of blood pressure, right? With the symptoms dizziness. We'll talk about all those in details, inshallah. And also hypoglycemia. Hypoglycemia is decreased level of blood sugar, usually in diabetic patients. Although some healthy patients, some healthy population without any previous diseases will have such case of decreased level of blood sugar. So before that, we will talk about critical case and how to deal with it. In medical term, there is an emergency situation, emergency room. There is a term, its name is A, B, C, D, and E. That's abbreviation for how to deal with a patient who is critically ill. A is shortage for abbreviation for airway, B for breathing, C for circulation, D for disability, and E is for exposure. In general population, you are meant to deal with A, B, C. D and E, it is mainly medical process in general. A is airway, as we say. Airway is your rule. If someone who fell down and has loss of consciousness, you need first thing is to deal with his airway. Airway is making sure the passage of the air is clear and there is no obstruction. In seizure patients, fits, we talked about earlier. In seizure patients, some of them will swallow their tongue, right? So your role is to pull that tongue out if you feel he is swallowing it. Another thing is some patients may be choking with food as they are on their office, sitting and eating something, maybe they will be choking, right? Your role is to take that out, the part of food which is obstructing the airway passage. Now, blindly, you cannot enter your finger and remove any obstacle. Blindly, you cannot do that because maybe blindly you will push that subject inside his airway. Maybe you are increasing the obstruction, which is causing his level of consciousness to be deteriorated. What you are meant to do is to open his jaw. If someone fell down, you need to open his jaw, check his tongue, check if there is any object obstructing his airway passage. If you can see something physically, you can see it, you can put your finger and move it out. Otherwise, don't approach him. That's for airway. Now for breathing. Breathing is the breathing rate, respiratory rate. Respiratory rate, it is the number of breathing the patient is taking per minute, right? Usually, and the normal, it is 13 plus minus 2. That's the normal range. And 11 between up to 15. That's the usual. In some cases of very high hyperglycemia, increased level of blood sugar, the patient will be tachypneic. And in some cases of chest infection, if it is severe and pneumonia, the infection is all over his lung tissue, the respiratory rate will reach to 25, 30 sometimes. That's critical also. But in general population, you can do nothing about it. C, circulation. It is circulation, we said A, B, C, right? C is palpating the pulse, taking a reading of his pulse by peripheral pulse. Sometimes, some expert, some who has some medical background, he can check the pulse by carotid. But some checking, palpating of carotid, you are obstructing the blood flow to the brain. So if you are not feel yourself as expert, medically expert about this palpating, don't approach the central carotid artery. Approach peripheral one. Peripheral one, it is you can, even if you put extra pressure, it will harm not the brain. The most precious, one of the most vital organs, right? That's A, B, C. That's in general. If someone fainted, airway, as we said, mostly, of course, call 911 first, and then check his airway. Until you will check his airway, it's supposed in such rapid response system in Dubai, after checking the airway, the ambulance will be with you reaching, and some medical response team will be with you. B, as we said, did not take his anti-epileptic medication. For first time, after he will reach the hospital, we will do brain CT to check if there is any structural abnormality in his brain. Usually, sometimes inflammation will cause that seizure, sometimes tumors will cause that, sometimes space-occupying lesion will cause such seizure and such causes. That's for the first time fit. For the second, usually after first time fit and after investigation, we don't give medication if the patient is free. After the second seizure, second episode of seizuring, and ruling out any other all his skills and functions, he can continue or they be taken, of course, to the emergency first.
There in kids also, right? Even for the kids also, this is.
Of course, actually, seizures happen also in kids. Sometimes in febrile, there is a febrile convulsion. Febrile convulsion in such season, it is influenza A and B season. So if the child temperature will reach to 40, 41, usually he will have some kind of febrile convulsion. You will, as the same, you will deal with your patient.
But is it the same thing? Like once he has a high fever, so is it that fit and this is the normal fit? Is it the same thing or?
The same, yes, the same. But in kids, usually the drive or the cause is the fever. That's why we need to aggressively treat fever in usually infant patients, infant kids. Infant is less than 1 year, right? So any less than 1 year kid, we need to deal aggressively with his high level of temperature. What's the measures you can take? I believe most of you have child in your homes. So what we can do, first of all, is the paracetamol, that's acetaminophen. There is a syrup and there is also subsidiaries. In infant, usually the dose is 125 subsidiaries you can use for your kid. Another thing is NSAIDs. NSAIDs is ibuprofen. It's another anti-inflammatory which will cause reduce of his temperature. Now you can alternate. This is something you will need as a father or mother. You can alternate between paracetamol, the Adol, and the NSAIDs. Each one can be given 6 hours apart. So you will give at the 12 midday Adol, and at the 3 you will give NSAIDs. Alternate. 3 hours gap. After another 3 hours at 6 p.m., you can give him again Adol. Then at 9, you can give him NSAIDs. So alternate. And they tried to get an IV access, but it was very difficult. Or you don't want, the case is mild, you don't want, but there's some dehydration, your doctor told you. The solution is the ORS. ORS is hypertonic. Hypertonic means hypernatremia. There is extra sodium inside that. It will increase the intravascular volume. It will make the blood flow is more easier to be flown to the most vital organs. The vital organs are brain, renal, the kidneys, of course, and then the heart.
Miss Alexis, she's going to help you during our event how to use our application. So I'm just going to explain for you who we are and what we are doing. Alma Healthcare, it's a digital healthcare platform that we are trying to make the people life easier to reach the healthcare. How many of you that going to a medical centers and waiting the approvals, waiting their turn to come for the blood test, or waiting in the line of the pharmacy to get their medicine? So we had this virtual clinic. It's exactly like we are doing the same job that the clinics and medical center are doing, by giving the consultation by our specialist, Dr. Muhammad, one of our team, that he's also doing the consultation through the application. So it's very easy for you. You can download the application, which we will be showing you now, and we will book consultation for all of you. You can book the consultation. You can select the time, the day that you want. And after that, you will do the consultation. If you will be required, if you will be needed any blood test, the doctor will be informing the team and the lab team to be coming to you after, of course, making sure that you will be selecting the day and the time that you want to do the blood test. Maybe you are in the office at the morning, so they can come to your office also, because we have a licensed people that they are allowed to take the blood from the place that you are in. After that, there will be a prescription mentioned by the doctor for you. I'm gonna give example like me. For example, I have a chronic disease, I have a cholesterol, so I have to keep renewing my prescription. So after 3 months, there will be a reminder sending it to me for like 1 week of the end of my prescription that I have to renew.